Hello and welcome to Homeopathy Made Simple University. Our mission is to empower homeopaths digitally. Want to learn homeopathy in a simple way? Then join us today. Subscribe to our channel and do not forget to hit bell icon below. Today, we will be discussing on how to treat acute cases quickly by using some simple tips. Generally, in all cases, we look for the essence of what is it that is asked to heal or treat. In case of acute cases, usually there is no exciting cause for some people acute illnesses. They simply not able to tell us the reason for illness or any exciting factor behind their illness even after good case taking. So, in such cases we have to alter our focus and see what is unique about the person's disease expression. Here are the simple tips to treat such cases. First, mental symptoms. Mental symptoms could be helpful here as common symptoms to any acute illness are not very useful. The reason being, in case of viral, you will have common symptoms reflecting in lot of patients and we may not able to differentiate homeopathically. That's the reason we can look for the PQRS that is unique, strange, rare, and peculiar symptoms which will help us to give quick snap of indicated particular remedy. So next obvious step would be to ask about what changes patient is observing since the time he/she felt ill. It could be one or two mental symptoms which will further reduce our choice of remedy much smaller. If it really expresses that person's personality. For example, patient is introvert or extrovert, feeler or thinker, diligent or non-diligent, oversensitive or indifferent, etc. Also observe for patient activity whether it is increased or decreased due to mental symptoms. Second, physical symptoms. Usually very common in acute cases. But here it is very important to understand the pathophysiology of any symptoms which will give us insight on stage of acute disease and its progression. Also, it helps us in defining the rubric, if you practice it in real world. For example, if the person is suffering from a rhinitis, then the most peculiar symptoms must be understood. It could be type of discharge, or a cough, sore throat, or itchy eyes. We also need to decide which symptom carries more weightage in that particular case. Or else you will always get polycrest remedy and then it's possible that we may miss the most suitable remedy. So, here also we need to look for PQRS symptoms which are undeniable and most unique to the case. Also observe for patient activity whether it is increased or decreased due to physical symptoms. Third, modalities. Human body usually expresses the illness in unique manner and can be differentiated on the basis of modalities. This helps us in our differential remedial diagnosis of the case in hand. For example, what makes the symptom better or worse, time of day, and position, etc. This will reduce the number of remedies we may need to look into. Record thermals, whether patient is chilly or hot. Ask for thirst, whether patient is feeling thirsty or thirstless, etc. Fourth, remedy sphere of action. After differential remedial diagnosis and you shortlisted few remedies, then look for its sphere of action. For example, you will find few remedies might be having special affinity for specific system or organ. Finally, select the remedy that suits and express the type of suffering the patient is going through. If a remedy has a great affinity for the digestive, respiratory systems, etc., and your person is suffering from an asthmatic cough, it is best to look at those remedies that affect the lungs and cough being a major part of the remedy. This will again narrow down your search for the suitable and accurate remedy. Fifth, minimize the selection. Try to minimize the number of rubrics and for that you need to consider the unique symptoms which are 100% expressive of the case, or else it would be confusing and that will complicate the case in hand. This approach helps to increase remedial diagnosis accuracy. Following these simple tips will definitely help you in getting results on ground and would make you much more successful while managing the acute cases in real-world scenarios. Subscribe to our channel and do not forget to hit bell icon below. Thank you for watching.